Well, hey guys, this is chapter 6. This is your last. I don't know if you can hear me because it's all. Okay. This is your last chapter lecture before your test. Your test will be on Monday. Okay. So this one's about 12 slides long. Hopefully it won't take too long for you. Okay. We left off with kyphosis as a disorder. We're going to continue talking about these disorders. You can see osteomalacia, osteoporosis, osteomyelitis. Those are reoccurring throughout our entire chapter. And it talks about the decrease of bone mass, right? Osteomalacia, you guys should be able to break that down. Malacia means softening, osteo means bone. So it's softening of the bone. And you can get it by decreasing the mineralization of bone to a lack of vitamin D or insufficient amount of vitamin D. It can be caused by a poor diet. It can be caused from a lack of sufficient sunlight. And they are finding that a lot of people are lacking sufficient sunlight because of the skin cancer scare. Okay, so now more than ever you're starting to see people on vitamin D supplementation. And then it can be a malabsorption problem. So the signs and symptoms, what are the signs and symptoms of osteomalacia? Well, bone pain. It's softening of the bone. You can have loss of your height. Gosh, I can't imagine losing any more height. And you can have some deformity of your weight-bearing bones. Okay, so your hips, your legs. Okay, you can have some deformity there. Diagnostic test, doctor's going to take a look at you, visual exam, and we're going to do a bone scan. And then what you do to correct that is you just correct the nutritional deficiency. It's that simple. Osteomyelitis. Itis meaning inflammation, osteo meaning bone. All right. So osteomyelitis can be acute or it can be chronic. Do you remember what acute or chronic is? Right? Chronic is a condition in which you've had for a long time. And acute can come on suddenly. Okay? So all of a sudden you can have inflammation of the bone or it can be a chronic condition. You can have an acute case of osteomyelitis by getting an infection in your bone. Okay? Which can often happen from having a wound in your skin. And staph. A staph, that's the common pathogen, Staphylococcus aureus. So what you're going to do is you're going to feel sudden pain, there's going to be swelling, heat, of course, because there's that vasodilation going on, and tenderness of the affected site. Because it's an infection, you're going to have high fever. And you're going to have chills. Why are you going to have chills? Think a minute why you're going to have chills. If you're having a high temperature, why are you going to have chills? It's because your body says, oh, I have to cool down, right? No, that's wrong. You have chills because your body's metabolism is going up. That's why. Right? Because when you're cold, your body produces chills to increase that metabolism to get your temperature up. That's why you have the high fever. Sorry. Sometimes you get nauseated and then you have malaise. Do you guys remember what malaise is? You're kind of tired. All right. Diagnostic test, once again, a visual examination. If this ever comes up on a test, you guys won't ever get it wrong. And then you're going to culture. And we've talked about culturing before. And then you're going to treat. It's an infection. You're going to give antibiotics, right? And then sometimes you might need debridement. So if it's from a wound and it's going into the bone, you're going to get necrotic tissue there. So it's going to get black, it's going to get smelly, it's going to get nasty. And they're going to have to go in and they're going to have to clean it. They're going to have to scrape it. That's what that debridement means. They go in and they scrape it to get rid of that tissue in there. Osteoporosis. Do you have a feeling this might show up on your test quite a bit? It's decreased bone mass. Okay, it can be due to aging, decreased mobility, estrogen deficient, or postmenopausal women. Okay, postmenopausal women are at a high risk of getting osteoporosis. So you're going to have decreasing bone density. You can have fractures, you fall out of bed, right? You break your hip, loss of height, all of a sudden you become short. You could have kyphosis, and you can lose about 4 to 5 inches. That would not be good because I would be like 4'8". That just would not be good. Osteoporosis treatment, early prevention, taking adequate dietary calcium, and again, avoid smoking and caffeine, a reoccurrent theme throughout the chapter. Engaging in weight-bearing exercise, supplemental calcium, vitamin D, and fluoride. And then there's special medications that can increase bone mass. You used to see those on TV quite a bit. Sally, not Struthers, Sally, I don't know, she played in, oh, what's that one with Robin Williams? She played in, oh, I can't think of it. Mrs. Doubtfire. Sally Field. She used to do commercials for increasing your bone mass. You don't see those too much anymore, but you can do that. Plantar fasciitis. I've had this, and it's not fun. It's also known as runner's heel. You get it from repetitive impact on your heels, and then what happens is you get inflammation of connective tissue on the plantar surface of the foot. Okay? That would be like this part. Okay? And if you have high arches or flat feet, shoes with poor support, that is why flip-flops are a big no-no, because they do not give you adequate support. Increase in body weight, hello, and sudden increase in activity. And also, what can predispose you to runner's heel is heel spurs. Yep, and I have one on each foot. Okay, so what do? Well, let me tell you, when you have it, you know you have it, because when you have been laying in bed and then you get out of bed in the morning for the first time, you can't even hardly put pressure on your heels. It hurts so bad. Okay, or you've been sitting for a long time in a chair and you go to get up, all of a sudden you have pain. Okay, I used to hobble out of bed. So what do? You get an x-ray. Okay, you get an x-ray and it can show you what's going on. I got an x-ray and it showed I had lovely heel spurs. So I did. I rested it. I put ice. I took pain medications, anti-inflammatory medications, patting a heel. A lot of times you'll very rarely see me wear flats. I have to have like a wedge. I have to have like somewhat of a heel because it takes the pressure off the bottom of my foot. Okay, and then sometimes what they have to do is surgically do possible surgical intervention, and they used to file the heel spur down, and they still do it, but for the foot doctor that I went to, and can you think of the name, what you call a foot doctor? Podiatrist. The podiatrist that I went to said they don't file them down anymore. Is what they do is they slice the tendon, and it elongates it. Don't matter. I haven't had it done, so I really can't tell you, and I hope I never have to have it done. I've even had shots for the heel spurs. I've had shots right in the heel of my foot. Not too bad. Doesn't hurt too bad because they freeze the area. Okay, then we have rickets. Rickets is a lack of vitamin D, and it usually occurs in childhood. And we learned about rickets, I believe, last year. It is because you have poor calcium absorption and bone calcification. Excuse me. So you end up with weak, deformed bones. The doctor will take a look at you, do an x-ray, and then take a patient history. And then they'll find out that you have poor vitamin D consumption. And so what they'll do is they'll give you supplementation of vitamin D and have you go lay out in the sun. No, They won't have you go lay out in the sun, but they'll want you to have more sunlight exposure, right? Because vitamin D production is increased in the sun. Scoliosis. Scoliosis is a sideway curve of the spine, okay? You can get it by being born that way. You can get it through trauma. So you have a lateral curvature of the spine, right? And it may lead to a backache. You might get tired, short of breath, that pulmonary insufficiency like you get with kyphosis. And of course, a visual examination, chest x-ray, or not chest x-ray, but an x-ray of your back. And then scoliosis, it depends on your age. I've had students, I believe, with scoliosis, slightly impaired, and nothing, no one's ever really complained. Exercise, wearing a brace, or some surgery. Tendinitis, I've had tendinitis too. Tendinitis, itis meaning inflammation, tendon of the tendon, right? Tendon. Tendons, ligaments. Do you remember which one is which? You might want to go back and review that section. Tendinitis etiology, repetitive movement or calcium deposits at the site. Mine happened to be from repetitive movement. I got it when I first started teaching, and I was at the typewriter all the time, and I actually got tendinitis. To do this killed me because my wrist was always bent, like out at the typewriter. So I ended up wearing a brace for a while, and it helped. Inflammation, it wasn't like my arm was really inflamed. It didn't look inflamed, but there was a lot of pain on movement. So I didn't have an x-ray. I did a lot of complaining, and probably through complaining of a patient history, that's probably how they ended up coming up with the diagnosis. So you're going to rest it, put some moist heat on it, maybe some cold, alternate it. We don't do it for longer than 20 minutes at a time with each one. 20 minutes heat, 20 minutes cold, 20 minutes heat, 20 minutes cold. Anything longer than 20 minutes, as you know from what you learned last year, it ends up having the reverse effects. So the treatment, you're going to rest. Oh, I already said that. Analgesics, again, analgesics, pain medication, and anti-inflammatory. And then you can get shots, okay, with corticosteroids. I never had shots for that. And then this is the part where I said that towards the end of the book that there was a pharmacology center, and it talked about the different kinds of medications that are going to be offered to patients with joint and bone disorders. Analgesic creams, okay, is something that a person could come in contact with. They often contain capsaicin, I don't know how to pronounce it, and you apply it to the affected site. I'm going to say a lot of it, the analgesics, is like Aspercreme, okay? Corticosteroid injections, that's injected right into the site. I told you I had that done with my heel spur. Pain medications, NSAIDs. So what are NSAIDs? You guys should remember this from when we did the pharmacology in the medical terminology. So can you remember what an NSAID is? Non-steroidal anti-inflammatory. I don't know what the D stands. Not anti-inflammatory. I don't remember what the D's are. Come back to me and tell me what the D is. Maybe there'll be an extra point in it for you. Message me on Moodle today. Okay, non-steroidal anti-inflammatory. I can't think of what the D is. So like I said, message me. I can give you a point, an extra credit point. Pain medications. Okay, NSAIDs, like ibuprofen and naproxen. Okay, ibuprofen, you probably heard of. Naproxen, maybe you heard your parents or your grandparents take. They treat inflammation and pain, but there's no steroid in it. Okay. Aspirin and acetaminophen treats pain, but there's no anti-inflammatory effect in there. Okay. So, there goes that. And then methotrexate, that's that cancer drug that treats rheumatoid arthritis. Calcium supplements, okay, that includes calcium base and acids. Can you think of one? Can you think of one? Can you think of one? Tum ta tum tum Tums. Tums. Tums is one. And it can help maintain or improve bone density. Okay. And then the last one, let's use our phonetics here. Alendronate. Alendronate. I think that's how you pronounce it. It's a powerful medication that improves your bone density. Okay. That is probably the generic name for that, not the brand name. Vitamin D improves your body's ability to absorb calcium, so you need your vitamin D. Drink your milk. Estrogen replacement therapy. That's for postmenopausal women, right? You give them estrogen, and it's supposed to improve their bone density. Okay. Now it's considered a controversial form of treatment because of the complications that can arise from ERT. ERT, estrogen replacement therapy. Okay. So now you're going to close this video out after you finish taking the test. And you're going to, or after you finish taking your notes, I'm sorry. I know it's late. I don't know how late it is, but it's late for me. And I'm going to go over the test with you on what you're expected to know. Okay? I'll be nice enough and do that for you guys because you'll have a test on Monday. Alrighty. Peace out.